Go.
I'm Jeff Young. My experience with healthcare starts when I was still a college student, when I was 24. I have an illness called schizoaffective disorder. The first experience with it, like I said, I was 22 or 23 in college, and I got taken to Covenant Medical Center. I didn't have insurance, so I got booted the next morning with the diagnosis of having taken too many drugs because I had taken shrooms a few days before. I went to the Abbey Center in Cedar Rapids after that, which is where they referred me to, which is a community mental health thing. And this is what that place is like, even back then. The doctor I saw there was there 2 days a week, saw 65 patients in a day. If you can imagine that. 65 patients in one day. And then I got shoveled into his thing. And I've misdiagnosed, of course, right from the beginning. He did the same thing, looked at it and said, it's the drugs, it's not a mental illness. After a little while, I stopped taking the meds because they were so expensive, and I couldn't afford them. I didn't expect my parents to pay for them. And he told me there's a 90% chance you'll never have any problems. Go ahead and get off the meds. So I did. And a year later, I was in jail from the illness because I didn't have any mental health care that whole year. I was in jail for 10 days. And that psychotic episode lasted almost a full year with 3 hospitalizations, the jail time, countless expenses. Anyway, when I got done with all that, I had to declare bankruptcy because of the $40,000 in hospital bills that I had racked up. And then from there, my ambition had always been to be a musician, and I'm a pretty talented one, I think. I do have some skills, and instead of pursuing that because of health insurance, because of the necessity of health insurance, I took a dead-end job in Cedar Rapids and worked there for a few years. I eventually quit to go back and finish my master's degree, and when I quit, I took COBRA. So in order to get my master's degree, I was paying $235 a month for health insurance and driving back and forth from Cedar Rapids to Waterloo, Cedar Falls to continue my education because I had to live at home to get it done. After that, I had no prospects of a job. Because I had a degree in music composition, so I was gigging. And I was doing like substitute teaching and things like that. No insurance. And the COBRA ran out after 6 months, after it was a year and a half. So I tried to find another policy, and I found a policy out of Florida for $350 a month after much looking. So I bought it, paid for it, did the interview with the guy, went to get my pills a week later, and none of them were covered. I was charged $1,500 for my pills, one setting of pills. Of course, I didn't get them. So for the next 3 or 4 years, I lived at the mercy of the pill company. I would go get a Medicaid refusal letter every few weeks and send it into GlaxoSmithKline, I don't know which company it was that makes a Abilify, but one of the companies, to get my drugs for free for another month. And I did that every month. When it finally got better, I had opportunities during this time. There is a really famous school. One of the teachers came to the college, and I was going to be able to interview with him and maybe go to school out there. And the whole time, I knew that it wasn't going to happen because I knew I couldn't go because of the health care. There was no way that I was going to be able to afford to pay for insurance. There was no way I was going to be able to get insurance. There was no way I could pay for the pills. There was no way I could pay to live, all because of my health care lack. It ruined every opportunity I had for a 20-year period, lack of health care and lack of adequate access to health care. And when it finally got better was in 2011 when I qualified for Medicare and Medicaid. I had to hit rock bottom before I could get health insurance, and it's been kind of a steady climb since then. I would not, if I lost Medicare and Medicaid, because of my diabetes now and because of my sleep apnea and because of the schizoaffective disorder and numerous other ailments, I would probably be dead in 2 years. At least I'd want to be, because I'd be in so much pain and discomfort. That's all I got.